First, I would like to say thank you very much to Mr. Konkolewski for inviting EU-OSHA to contribute to this conference. It's my great honor to present the activities and approach of European Agency for Health and Safety at Work to the topic related to mental health at work. And first, let me apologize because it seems I was in the middle of the screen, so I'm probably appearing in a lot of your pictures. A few words about the agency. As it was already announced, this is the institution of the European Union, which is based in northern Spain, in Bilbao. And it was set up in 1996 to help improve the working conditions of, and provide technical, scientific, and economic information to all those interested in health and safety at work. We do that and we put the scientific information into practice through a dialogue with our tripartite board and network that includes policymakers as well as representatives of employers and workers. And during my presentation, I will shortly highlight the main approaches towards managing psychosocial risks and mental health at work. And let me stress that the focus of the European Agency is not only on people who are experiencing mental health problems, but it's very much also focused on people who are healthy, trying to assure that those people will stay healthy through their working life and also will be able to enjoy their retirement while having good mental health. Just to put my presentation into some context, EU-OSHA did the opinion poll through a number of European countries. We asked European people, what do you think if work-related stress is common in your workplaces? And we can see this blue and red area, and on average, 50% of European workers said that stress is fairly common or very common in their workplaces. In addition, around 4 out of 10 workers thought that this issue is not handled very well in their workplace. The Euro Commission Eurobarometer showed that 27% of respondents suffered from stress, depression, or anxiety related or worsened by work. And this was self-reported problem. This was obviously not based on professional diagnosis. But it shows the scale of the problem and the perception that work-related stress is a problem for many workers and is not being tackled very well. When we talk about psychosocial risks, we relate and we refer to those work characteristics that are related to bad work organization, poor work design, poor management, and unfavorable social context of work. The work characteristics, when they are excessive and prolonged, they may lead to work-related stress, which may result in poor mental health or other physical problems. Those problems appear when the excessive pressure is prolonged in people who are initially healthy, and of course they make the situation of people who are struggling with some mental health problems in the first place, they make their situation much worse. The research carried out over the last few decades identified a number of work characteristics that can contribute to work-related stress and mental health problems. Some of those characteristics may be well known to you. This includes excessive demands, including emotional demands. This is lack of involvement, lack of support, lack of recognition, violence, harassment, conflicts at work, job insecurity, or poor work-life balance. And there is a lot to do in the traditional workplaces. There is a lot of room for improvement, and it was widely acknowledged today and also yesterday. But it was also mentioned yesterday that the world of work is changing dramatically, and we also have to remember about that. And while these work characteristics are still valid for this changing world of work, the context of work is changing remarkably. And just let me give you one example. There is more and more workers that don't have any contractual relationships in a long term with their employers. They are, for example, workers that are employed through internet platforms. They have never seen their employers. They have no security. They have no protection. And, for example, they are employed to spend several hours every day to search the internet for hard pornography and hard violence and report it, and this content is consequently removed from the internet. However, nobody is actually checking if these workers have psychological predispositions to do this kind of work. Nobody is monitoring how it affects their mental health. Nobody is helping them and training them how to deal with this kind of job. So this is an example that shows that we are somehow losing more and more workers because they are not included in the traditional structures. A few next slides present the figures from the survey which EU-OSHA carried out in 36 European countries. And this was a survey that asked establishments or different sectors, sizes in private and public nature. We asked them, how do you recognize risk factors for health at work and what are you doing about that? And this first slide presents the risk factors that were identified by representatives of those companies. And we can see the risk factors of psychosocial nature that can be problematic and lead to mental health problems. They are marked in yellow. And the first, most important, most frequently reported risk factors, even more important according to the companies than accidents or musculoskeletal disorders, was the fact that workers have to deal with difficult clients, pupils, patients. So the difficulties in social interactions was reported as the most important problematic risk factors at work, which in the fact that the service sector is growing can indicate also that this issue may be growing in importance. The other psychosocial risk factors identified included time pressure, long working hours, poor work organization, job insecurity, discrimination, or lack of influence. There were a number of questions. This is just highlights of some of the figures. Let me mention that if you are interested to know the details from different countries on different issues, all this data is available through EU-OSHA website. We asked if establishments employ any service, external or internal, providing psychological expertise where identifying risk factors or planning and implementing preventive measures in this area. And in general, across Europe, only 16% of enterprises said that they actually, indeed, they use some kind of psychological expertise. And there were only a few countries, with Finland and Sweden being on the top, where nearly 60% of establishments said so. But these percentages are very, very low in the most European countries. We also asked about the preventive measures actually implemented in the company. And I need to highlight that there are examples of workplaces that indeed employ good specialists and they implement preventive measures, and we will hear some of those companies that are excellent in terms of preventing mental health problems and helping people with mental health problems. We will hear later at this session and in the afternoon. Just looking at this picture, just let me highlight that while having some kind of procedure to prevent violence at work or psychological harassment was reported a little bit more frequently than having an action plan to prevent work-related stress. Only around 30% of companies said that they have this kind of action plan, which leaves 70% of establishments that actually don't do any check in terms of risk factors for mental health for their workers, and they don't implement any prevention measures to deal with work-related stress. And that also includes providing training. only around 30% of establishments said that they include some information on how to prevent psychosocial risks and stress into regular training, provided to employees and provided also to middle management, so to people who are dealing with workers on a daily basis and who are and should be the first ones who know how work can affect workers' health. And finally, let me highlight the results which were related to identified obstacles to deal with those issues. We asked what are the most important difficulties in addressing psychosocial risks. And as you can see, to the companies of different sizes, the blue bar indicating reluctance to talk openly about those issues, which was reported as much more important than lack of expertise or even lack of awareness. And this problem was particularly important in larger companies, so not only in smaller ones. And what we can say is this reluctance is the stigma around mental health and work-related stress has been also frequently highlighted yesterday and today. Workers don't want to talk to their employers about their problems with mental health. They feel very vulnerable. And on the other hand, managers, they don't want to talk, they don't want to ask, because even if they are concerned, they don't feel that they have enough competences to deal with those issues. They are afraid to ask. And also, work-related stress and having some kind of mental health problems related to the work is quite often understood as an individual weakness, not as a problem with work organization. We need to provide support. Obviously, if we want to prevent mental health at work, we need to make a change in the workplace level, and employers must be provided with support, and this support must be provided at different levels. It must include policymakers, and in fact, the European legislation puts an obligation to the employers to implement preventive measures to prevent and to assure that workers' health, including mental health, will not be affected in a bad way in the workplace. And we also have some results indicating that this push for the policymakers from the legislation is an important motivator, is a driver for employers to implement some measures. But it cannot work as the only factor. We also need to provide practical support. And this slide is, this is a very simple approach, and we try to, because we realize that we are talking to employers and workplaces, we need to use a simple language, and this is not to trivialize. This is not to say that this issue is actually very easy. No, this can be very complicated, and mental health problems and the dialogue on the workplace level can be pretty challenging, but still it is possible to do the positive change. But we want to talk to employers and tell them that actually managing psychosocial risks and preventing mental health problems at work should be part of doing the business and should be tackled in a way that like other business aspects are being tackled. Although specific measures are needed, but the approach to risk assessment, to developing, implementing action plan is based on exactly the same principles. And employers must be aware that what is required from them is not providing treatment for people, that they don't need to have psychiatric expertise, they don't need to treat people, they just need to take care of the work environment and make sure that this work environment is safe and it's healthy, and facilitate external help when this kind of help is needed. We also highlight that when they are doing this, in this process, it must be based on a dialogue between managers and workers. Without this dialogue, a positive change is not likely to happen. And finally, we highlight that when dealing with psychosocial risks at work, the priority must be given to the organizational measures. Although the EU-OSHA endorses the approach that the holistic view is the most effective, and we need to look at the workplace, but we also need to be aware about the living environment and the other problems workers may be struggling with. However, it is important to remember that work must be adjusted to the abilities of workers, that it cannot be the other way around, than the workers' abilities are being stretched to the limits to make them fit for work. When saying thank you, I would like to invite you to visit the EU-OSHA website. EU-OSHA is organizing an European raising awareness campaigns. And in 2014 and 15, the European campaign was focusing on psychosocial risks and preventing work-related stress. This campaign website is still operating. It's available in 25 languages, and you can find them promotional material, also practical checklist or practical guidelines, and any other publications that is related to this topic. Thank you.